Okay. It's Tuesday's tip with Dr. Britt.
This week's tip, we're just going to talk about ACL injuries. ACL, or anterior cruciate ligament, is a ligament in your knee that gives you support for rotation, extension, locking it down, and movement. The stats show that female athletes are at a greater risk for ACL injury than male athletes, 4 to 6 times, and high school females have a 9 times greater chance of an ACL injury. If you look at the rest of the statistics, 80% of those are non-contact. So if it's a non-contact injury, then it is a modifiable risk to possibly prevent and keep those from happening. How do you know you might be susceptible to it? Well, unfortunately, female athletes in a dynamic sport like softball, soccer, lacrosse, field hockey, they happen all the time. And you'll see them when they do a cut, you'll see a collapse. When they jump, the knees will collapse in. Those are things we look at when we're kind of testing for the potential for ACL injury. Can you strengthen those up? Absolutely. There is a good rehab program that you can involved in through the gyms. Strengthen up the glutes, strengthen up the movement patterns, and you'll prevent a lot of those from happening. We're looking at creating an ACL prevention workshop and maybe lasting over a couple weeks, giving you some exercises that you can do as your warm up, and it might last about 30 minutes a day. So if it's something you're interested in, please feel free to reach out to us. We're going to gauge the interest, and then we'll go from there. We want to help you move better, feel better, live better, pain-free. And if we can prevent it, you know what our saying is, I don't want to adopt you, so let's get it fixed before it happens. We're here to help you, so don't hesitate to reach out and let us know if it's something you would be interested in.